The first exercise is teaching the patient lumbopelvic neutral. I'm explaining to my patient that by learning lumbopelvic neutral, we can begin adding in more core exercises and then eventually advance to more strengthening exercises with loading now that we know that the trunk is properly braced. I'm having my patient imagine that their hips are a bowl of cereal. I want my patient to pour the milk out of the front of their hips and create an arch in their back. Then I want them to pour the milk out of their back towards their butt and curve their back. Then I want them to keep decreasing the amount of milk that pours until their milk is no longer spilling and their back is in a pain-free position. Next, I'm teaching my patient how to properly diaphragmatically breathe. I'm having my patient brace their core and lumbopelvic neutral to make sure it's tight, and then have them breathe through their belly, not their chest. I'm also making sure that my patient is taking slow and controlled breaths rather than an increased breath rate. I can also place my hand on their belly to see if it rises. The next exercise I'm teaching my patient is a regress dive bug. I'm going to have my patient find lumbopelvic neutral and making sure to check their lordotic curve as well as their stomach to make sure their core is engaged. I'm reminding my patient that they need to diaphragmatically breathe throughout this exercise. I'm having my patient bring up their arms to 90 degrees of flexion and to check that they are still diaphragmatically breathing. Next, I'm having my patient bring her legs up to 90 degrees of hip flexion. You can see on the left that I made a correction for my patient, as her legs were in more than 90 degrees of flexion. As my patient is continuing this exercise, I'm going in and checking to see if their core is still engaged and that they're in lumbopelvic neutral the entire time. I'm having my patient hold this position for 30 seconds for 3 sets. The next exercise is the open kinetic chain short arc quad from 90 degrees to 45 degrees. This exercise is perfect for patellofemoral pain because it does not stress the joint past 45 degrees of extension. I'm measuring with my goniometer to 45 degrees and then having my patient hold that position. Instructing to my patient that I want her to extend her leg for 2 seconds and then bend it back in for 4 seconds. I am also mentioning that I do not want her to bend her leg more than 90 degrees as I want her to keep the book edge. As my patient is completing the exercises, I'm counting the seconds in and out and reminding my patient that she should be in a pain-free motion. As my patient is continuing the exercise, I'm making sure to give feedback such as good job with the tempo. As my patient is doing this exercise, I'm also explaining to her that if she doesn't have anyone at home to help her, she can also use a bed, chair, anything like that to use as a cue to extend into till 30 degrees and then stop and bend her knee back in. The next exercise is a closed kinetic chain terminal knee extension from 0 to 30 degrees with a yellow TheraBand. I'm instructing to my patient before beginning the exercise that I want her to find lumbo-pelvic neutral and slightly retract her shoulders and slightly tuck her chin. I'm then instructing my patient to bend her injured knee, which is her left leg, to 30 degrees and then contract her quad to bring her leg back straight. I'm having my patient keep the same tempo as the first exercise of 2 seconds to bend her knee and then 4 seconds to straighten. I'm also having my patient do 3 sets for 10 reps each. I'm watching my patient do a full set and using my hand as feedback. I'm using a yellow TheraBand as this patient is just beginning, but I can increase the resistance over time to a different color TheraBand. The next exercise for this patient is a straight leg raise into hip extension. I'm having my patient find lumbo-pelvic neutral before starting the exercise, and my patient is told to keep the same tempo of extending up for 2 seconds and then controlling back down for 4 seconds. I am reminding my patient to keep their knees straight when moving and to make sure that their hips are staying on the table the entire time and not lifting one hip up and compensating for the other. During my patient's exercise, I'm also stabilizing at the hip and reminding my patient to go through the full motion. If my patient is completing this exercise at home, I can have someone else at home stabilize their hip, and if they don't have anyone, they can always place a pillow on their back to help them cue to keep their hips down. The next exercise is a Romanian deadlift or RDL, and this exercise begins with the patient's feet shoulder width apart, engaging lumbo-pelvic neutral and retracting their shoulders slightly. I'm expressing to my patient that I want the pole to be touching her butt, the middle of her back, and her head for proper form. I'm showing my patient that I want her to just bend at the hips, going back for 2 seconds and then coming back up for 4 seconds. For this exercise, we are targeting the eccentric strengthening of the hamstrings. So to prepare, I'm having my patient find lumbo-pelvic neutral and make sure that there are the 3 points of contact on the pole. As you can see, my patient's form was incorrect as she's bending at the knees. To correct her form, I'm just reminding her that I want her to act like she's pressing the elevator button with her butt. I'm also making sure that my patient isn't lifting up her feet and placing all of her weight on her heels or her toes. After a few corrections, her form looks great. The first functional test is the star excursion balance test. This test begins with the patient standing on the injured leg and moving her uninjured leg forward and touching as far as possible. I'm making sure that for each motion forward that my patient is not stepping on the uninjured leg. I want all of her weight to be on the standing injured leg. I'm also making sure that my patient isn't creating a valgus or varus stress at the knee and that her knee is going straight over her toes. Next, I'm having my patient go posterior lateral and again looking for movement at the knee. And lastly, I'm having my patient go posterior medial and looking for movement at the knee. As my patient is doing the star excursion balance test, I'll be placing tape where her foot touches the ground, and I'll be measuring afterwards by adding up all the distances and dividing by her leg length. Before my patient begins, I'm making sure that she's in lumbo-pelvic neutral and again giving her a tactile feedback and making sure her shoulders are slightly retracted. I'm just instructing my patient to go as far as she can while keeping her knees straight over her toes, and then I'm placing the marks for the tape. On the left of the screen, you can see her measurements and then the total score. The next functional test is the tuck jump test, which consists of the patient doing continuous tuck jumps for 10 seconds. There are 10 criteria to be met, and for each criteria failed to be met, there is a point given. After 6 points, the patient is required to seek more training. On the left-hand side of the screen, you can see that the patient exceeds the 6 points. Therefore, she can benefit from further training. On the right-hand side of the screen is after corrections, and you can see a difference in her score from 8 to 4 criteria not being met. Based on this score, the patient can still benefit from more training, but she can safely return to play. The lateral view of the patient gives you a better idea for some of the criteria to be met, as you need to look at this patient from different angles to test all 10 criteria.